So, respected chairperson, and good evening, everyone. In fact, sir, to your information, I have called all they are the AJIT team.
Yeah.
So,
God bless you all.
so the topic is quality assurance in a high volume cataract surgery. Quality is never an accident. It is always the result of intelligent effort. It is a general perception that quality and quantity don't go together. But it all actually depends on the mindset of the individual or an organization. And Akhan Jyoti is a high volume setup, which has just been started in the year 2006 with a 30-bed eye hospital and 7,000 surgery in the very first year. And now we are 375 bed eye hospital, and we are operating about 76,000 surgery per annum. And apart from that, we have a women empowerment program where the rural girls are taking the education at our center. Right now we have a 22 vision center and 5 surgical centers. And by in next 4 years, we are looking forward to have a 1100 bed eye hospital with a upcoming 750 bed center of excellence. In a rural, it will be a first of its kind in the rural backdrop. So, is there any rationale for a high volume cataract surgery? The 2.2 billion people are visually impaired across the globe, and among that 1 billion needs they are not either have been attended. So, cataract continues to be the leading cause of blindness and severe visual impairment. WHO promotes the high volume surgery to eliminate the backlog of blindness. And recently, last year in the May, the Health Ministry of India has convened a meeting that another 10.3 million of cataract surgery are required to eliminate the backlog created by the COVID pandemic. So there is a rationale for a high volume surgery. And so, is there any rationale for high quality? Yes. If we have a literature search, then across the globe, there are a lot of variation in the visual outcome of the cataract surgery. If we go for the sub-Saharan African country, then there are 40% of the patients, they don't have a good visual outcome that is below 6/18 as per the WHO benchmark. And even in India, the 37 to 74.6% the visual outcome in general post-cataract surgery. And apart from that, these are the reported cluster outbreak across the country. It's the figure of the India only, and these are the reported, and there are various unreported cluster infections as well. So quality is an essential component of universal health coverage, where every people should have the best quality of service who access the service without suffering the financial hardship. The basic principle of quality assurance is, it is basically oriented towards the how robust your system and the process, and it meets the needs and expectations of the patients. And it uses the data to analyze the service delivery process, and basically it encourages the teamwork to improve the quality. Quality is the simplest language, doing the right thing, right first time and every time. So it is not a one-time event, it's a cyclical process, and there is an incremental process, and it should be self-motivated. And to implement the quality, every organization should have its own quality policy. This is the quality policy of Akhan Jyoti, which should be aligned with your vision and mission. And there are 8 elements of the quality as per the WHO, that it should be an integrated, people-centered, not only patient-centered, employee-centered. It should be safe to the patient, timely, equitable, and it should be accessible to the entire community, and it should be efficient and effective. So the major drivers of quality at Akhan Jyoti are, and Akhan Jyoti, I will just, it's like a case study, but it applies to everything. It basically depends on the how you inculcate the culture and the value of, so it's the role of leadership. And the second thing is the infrastructure, the building, the capacity of the bed, the number of the operation theater, the equipments, how robust they are, and all the facilities, they are compatible with the, you should strike the balance between the demand and supply. And there should be a robust system and protocol for each critical steps. We should encourage the best practices, and there should be, we should strive for the continuous improvement by fostering training and training. So to ensure the quality, it starts from the first contact with the patient, that is outreach and primary vision center. And we should have a defined care pathway. Of course, once the patient arrives, the comprehensive eye examination at the base hospital, you should have a checklist, standard operating procedures, the guidelines, the protocols, and throughout we should adhere to the infection control policy and the safety policy. And you should always measure the outcome to ensure the follow-up. It's not moving? So how does the outreach? Outreach does not only help in the demand generation, it also helps in ensuring the follow-up and referral to the patient, timely referral to the patient to the base hospital. If you have an integrated teleophthalmology, then it further substantiates the quality as Dr. B.N.R. Subudhi was talking about. And once the patient arrives, if there is a defined care pathway, then it facilitates the flow of the patient because you have to deal with the high volume. And the lean management, this concept has come from the Toyota Motor System, where you eliminate all the non-value added waste and you facilitate those tests or procedures which adds to your focus. Like doing ECG or like doing routine test in all ophthalmology, you don't do. So you stick to the blood sugar random or like that. So there is no replacement for the comprehensive eye examination. So you should do the detailed eye examination at the base hospital and all the pre-operative assessment. Before that, the verification, because you don't need to do any error in identification, and case selection. The proper case selection determines the visual outcome. And at this time, you highlight and segregate all the complex cases and the eyes, those who have a ocular or systemic comorbidity, prioritize them, schedule and plan beforehand, check the requisite supply for the surgery beforehand, inform and discuss with the entire team. So you should have a surgical protocol. The most important thing in the operation theater is the discipline, attitude, and how the team works in the sync, because everything is orchestrated. And again, you reconfirm the right eye, right IOL, right procedure, right patient, and have a real-time documentation so that you can monitor later on. And in a high volume setup, all the steps, whether it's surgical steps or the complication management or the training procedures, it should be standardized so that you can monitor. If you are having a training protocol, then it should be supervised and encourage the wet lab and simulators. We have eyesight simulators. And your operation theater should be ready for any kind of ocular complication or medical emergency. So check for the vitrector, check for the iris hooks, CTR or oxygen, emergency trolley or whatever. And don't do any septic cases in a main operation theater. These are the operation theater checklist, the pre-operative checklist we are using. And you can always find it in the other side, AIOS, WHO, the American Academy of Ophthalmology. This is a surgical safety checklist. Before patient enters into OT, once patient finishes, you finish the surgery, once the patient leaves the theater. And the second thing, the adherence of infection control. So the most important thing is how sterilization and how your infection protocol is there, infection control protocol. So there is a layout of operation theatre. It should be segregated into outer zone, clean zone, aseptic zone, and disposal zone. And second thing is, you should have a proper central sterile supply department with a proper cleaning protocol. And third thing is, you should have a surveillance and monitoring mechanism. It should be a regular, and sometimes it should be, you should visit without information. The operating room environment, the air, surface, water, the culture, weekly culture of the air, fortnightly culture of air, and the monthly culture of RO water. You should check the sterilization process by logbook, maintaining the logbook. How effective is your sterilization? By using the chemical indicator or sometimes biological indicator. You check the surgical supply. Any kind of surgical supply you are using for the first time, you should send it for the culture. If it is okay, then use that batch. If you have any kind of a surgical site infection or inflammation, there should be a reporting and addressal mechanism. You should have a hospital infection control committee who will do the root cause analysis and the corrective and preventive action. And the next thing comes the safety of the patient. So for ensuring safety, we should create the awareness about the safety across the entire stakeholder of the organization, right from the patient to the entire staffs. And you should define the safety goals. There should be a culture of any kind of incident reporting, sentinel event or adverse event or near miss report, and then do the root cause analysis. Why did it happen? Go into the root cause, then do the corrective and preventive actions, and once you settle the thing, reinforce the same thing. So these are the safety goals: ensuring correct patient, correct eye, correct procedure, and the correct intraocular lens. Prevent mortality and morbidity due to systemic complication. Prevent hospital-acquired infection by hand hygiene, by all kind of septic and disinfection procedures. Eliminate medical and diagnostic error.
Sir, please sum up, sir.
Ensure physical safety in the bathroom, ramp, use the ramp, and ensure follow-up. Time ho gaya, sir? Okay, thank you, sir. This is the outcome and benchmarking. So in the outcome, you should have a monitoring system, and you should do it the WHO benchmarking. So these are and it's not about the visual outcome, the overall satisfaction of the patient. Document everything right from each and every steps, guidelines, protocols, document well. Improvement in quality is day-to-day work. Both clinical and non-clinical care affect the quality of service. Quality can be improved in a small, affordable. Cleaning doesn't take a lot of money, but having a femtool takes a lot of money. And know your limitations. Strong leadership and culture development. Quality is critical and achievable in a high volume setting. Thank you. Sorry, sir.
Thank you, PODDAR. No issue.
Thank you.